Thank you for taking part in WorkSafe's Health and Safety Month. This morning's topic is on psychosocial hazards in the workplace. My name is Natalie Wellard, and I am a Manager of Legislative Services and Reform in External Affairs here at WorkSafe. I will be your host for today's session. I am joined by two of WorkSafe's experts in this area, Dr. Libby Brooke. Hi, Libby.
Hi, Nat.
Libby is our Principal Psychological Health and Safety Specialist. Her team in the Psychological Health and Safety Unit focuses on prevention of psychological injury in Victorian workplaces. And Amy Salmon. Hi, Amy.
Hi, Nat.
Amy is a registered psychologist and Senior Psychological Health and Safety Specialist at WorkSafe. Libby, Amy, thank you for joining us. Today's session will run for about 45 minutes. In the first half, we'll be discussing the nature of psychological risks in the workplace and why they can be just as harmful as physical hazards. As an employer, understanding your responsibilities in this area is important to safeguard your employees' psychological health and safety. In this session, we'll discuss psychosocial risks in different work contexts and how employers can identify, assess, and control those risks so far as reasonably practicable. Then we will open it up for audience questions via the chat box at the bottom of your screen. You can also vote for your questions to be answered. So you can put your questions in the chat box at any time and vote at any time so that we're ready to go at the end of the session. Finally, before we begin, some of our content today may include material of a sensitive nature and may be a trigger for some of you. If that happens, please feel free to walk away from the seminar and join us when you feel you can. If you have any concerns or questions about your individual circumstances, please give our WorkSafe advisory line a call. Okay, let's get straight into it. I'm going to start with you, Libby. We all know how important mental health is, and we have seen a big focus on this area in workplaces over the last few years. What does the data tell us?
Thanks, Nat. Yeah, so there are some stats that we refer to a bit. So if we look at mental health in Australia, we know that approximately 45% of Australians will experience a mental health condition in their lifetime. And what's important to note is that approximately 1 in 5 Australians will experience a mental health condition in any 1 year. So it is an important part of people's working lives as well. We know that mental injury is the 4th highest cost claim. So that's an average of $86,000 per claim. And so we also know that it takes a little bit longer for mental injury claims to go back to work. So by 6 months following a mental injury, only about 54% have actually returned to work. And then when we look at 2 years down the track, approximately 38% still haven't returned to work. So we know that there's a high impact on workers.
Thanks, Libby. It certainly sets the scene for how important this discussion is. Amy, can you talk us through what the work-related factors are that would influence workplace health and safety and wellbeing, and how psychosocial hazards fit in?
Yeah, thanks, Nat. So when we're talking about work-related factors, what we're talking about are the factors in their design or management of work that can positively or negatively affect an employee's mental health. And when we're talking about psychosocial hazards, we're talking about the possibility of them occurring when those factors are poorly done or managed. And the hazards can then increase the risks to psychological or physical health and safety, and therefore can negatively impact a person's mental health. So an example of a work-related factor might be job demands, and the psychosocial hazard that might present itself could be a high or low job demands. Another example of a work-related factor is support, and the hazard might be poor support or a lack of support. Some other psychosocial hazards to be aware of are low job control, bullying, gendered violence, violence and aggression, remote or isolated work. And that list isn't exhaustive, and the way that those hazards might reveal themselves can vary. So as you can see, sometimes the hazard will manifest as behaviours, whilst at other times it might be about systems of work. And very often the hazards can be overlapping and co-occurring. Some of the hazards we see more often in the workplace, and some of them you might not have even considered to be a hazard. So we just need to be aware that new or different hazards may be active or present, dependent on key factors such as the industry that you work in and the nature of the work.
Thanks, Amy. So I'm sure there is a strong legislative framework that employers need to be aware of to manage these risks. Libby, I'm going to move back to you. Could you outline what duty holders' current responsibilities are in relation to managing psychological health in their workplace?
Thanks. Yeah, so currently under the Section 21(1) of the OH&S Act of 2004, employees have a responsibility to provide and maintain for their employees a working environment that is safe and without risk to health. And we know that in the definitions in the Act, it says that health includes psychological health. So it's really important for everyone to understand that it is a current duty under the Act. And we need to, I guess, understand that this involves identifying and controlling those risks to psychological health in their work environment. And it may be that they put it in their risk register, etc. It's important that employers treat it the same as they would a physical hazard.
Great. And Amy, how would an employer go about treating psychological hazards like physical hazards?
Yeah, thanks, Nat. So ideally, an employer would do this by taking a risk management approach. So similar to what you would do with a physical hazard. So firstly, as an employer, you're looking to identify the hazards or the psychosocial hazards that exist in your workplace. And then you would assess the risk that those hazards potentially pose to workers' in psychological health. That is, you consider what the potential outcomes might be if your employees were exposed to that risk. Then, once you've identified the risk, as an employer, you'd be putting in place controls to eliminate, where possible, or reduce the risk as far as reasonably practicable. And all of that information can be documented in your risk register alongside any physical hazards.
Sounds like a pretty good plan for employers to follow. Libby, can you help our employers out by providing us with a good first step to take to tackle some of these hazards?
Sure. The first step in preventing and managing the hazards is to know what these hazards are in your workplace and how they look in your workplace. And that these, I guess, understanding, as Amy alluded to, these hazards just rarely happen on their own. There's often multiple psychosocial hazards that can overlap as well. So understanding that what they look like and how they look with other hazards, or if there are other hazards that are alongside it. And the best way to start that is to consult with your employees. Helps you to understand what they're experiencing.
That's great. I'm going to stay with you, Libby. Are you seeing any misconceptions on how mental health concerns are being managed in the workplace?
Yeah, the biggest misconception that we see with employers is that when an employee presents with concerns relating to their mental health at work, EAP is the most appropriate control, is the assumption. The problem there is twofold, though. The individual gets the message that they're the problem that requires attention, and that's not correct necessarily. And this does not allow the employer to actually understand the psychosocial hazards that may be the cause of that harm or distress, and therefore that's something that they need to prevent. So if they don't look, they don't see it. So if we take, for example, first responders who are regularly exposed to traumatic events and work-related violence, so these are inherent psychosocial hazards in their role. And while EAPs may provide a role in supporting that stress management and afterwards debriefing, etc., they will not control all of the risks associated with the hazard in the workplace. So a much more effective way to approach this would be to apply a risk management system within the workplace for exposure to these hazards by identifying the hazards exist, the likelihood of the psychological and physical harm that may come from that exposure, and employers should then look to design controls to effectively prevent or reduce the exposure to those hazards at work, and then look to the supportive controls after the exposure as well.
Thanks, Libby. Amy, in your experience, what hazards do you see as most prevalent when it comes to work safe inspection?
Yeah, thanks, Nat. So in my experience, the most prevalent hazards are workload related. That is high work work demands or job demands, as well as risks that arise from poor interpersonal relationships. So that might present as bullying complaints and work-related violence. And so what we sometimes see happen is that the hazards show themselves in stress and bullying complaints. More often than not, as we've kind of discussed a little bit earlier on, we see the hazards occur concurrently. And so what that means is that the remedy really needs to address this and focus on the key contributing factors to the presenting complaint. So an example of this might be that there's a manager who's experiencing their own workload pressure and therefore might find it difficult to engage in some of those challenging conversations that they need to have with their staff members. And the impact of that is that it might lead to the development of interpersonal difficulties between that manager and their team. And then the impact of that is that on a surface level, the team members may then perceive that they're being bullied by their manager or experiencing a level of poor support. However, the underlying issue that's driving the manager's poor behaviour is an unmanageable workload.
Thanks, Amy. It's so interconnected and anyone is vulnerable. Amy, could you provide further information on this example and how you think the issues could be prevented?
Yeah, so in this instance, I think it's important to be able to identify that an issue with the manager's workload exists. So identifying that psychosocial hazard early helps to ensure that appropriate interventions can be put in place to reduce the risk of further psychosocial hazards having an impact. Consultation with employees relating to their own experiences in the workplace can help to identify psychosocial hazards on an individual, team, and organisational level. And then once the hazard has been identified, in this case, beginning with a focus on addressing the manager's high job demands, then we can look at strategies to potentially reduce that workload. So a strategy involved in this might be to redesign the manager's role and hand over some of those administrative tasks as part of their role to an admin person. Alternatively, an organisation could look to promote a team member to a second in charge role or advertise to recruit a senior member of the team with the aim of assisting the manager to delegate some of the tasks associated with their role so that they can then focus on supporting and managing their people well.
Thanks, Amy. Examples are always so helpful. Libby, could you give us another example with some of the other hazards that we've been speaking about today?
Sure. Another example would be, for example, work-related violence. So we've seen that involves maybe employees dealing with members of the public or patients, or it could be in an aged care facility, it could be teaching, it could be health, it could be retail and so on. So where they face those potential for work-related violence from customers or clients. And it may be that these risks are known to the organisation and the organisation may have documented evidence of this risk. So there may be that there's hazard reports being put in or incident reports. So as a result, the organisation may be able to implement systems for I guess, such as placement potentially if it's a client, or behaviour management and environmental controls. So there are different controls that may be relevant to each situation to ensure that that risk is reduced as far as they possibly can. So possible controls may include behavioural management plans, outlining risks, triggers and actions, or having a safe place for staff to retreat to if the client's behaviour escalates. In addition, it's important to support staff who are working in this setting. So it may be that that's done through a two-up setting, like so where you have to work with someone else, or having a supervisor readily contactable so that they have an escalation point if things do get out of hand. And support may also include a system which outlines pre-planned actions to take following an incident, and that may include your EAP services, and a process for reporting should an incident arise that was unable to be prevented. So it's important that these processes for reporting also involve a review process to give consideration to amending those controls or adding additional controls to make sure that in future you're reducing that risk as far as you possibly can.
Thanks, Libby. Amy, back to you. What do you think is the key to managing these hazards?
Yeah, I think the key to the successful management of hazards and risks is really leadership commitment and supportive, capable management and supervision. So what that means is a focus on creating an organisational culture where psychological health is seen as important as physical health, as this will assist in providing an environment that allows hazards to be identified and controlled as far as is reasonably practicable. And communication and consultation with workers and other stakeholders is important at all stages of the process. They really need to be involved in the identification of the hazards that exist in their work environment, and also the design of controls or strategies to fix the problems that have been identified. And organisations should focus on developing and implementing an integrated systems approach, looking at all the factors and controls to ensure that a safe working environment is in place. And this involves reducing the risks as far as they can. That creates that environment.
Thank you so much, Libby and Amy, for your insights. Psychosocial hazards are an OHS issue that can be addressed in a range of ways. Much like a more obvious physical hazard, they need to be taken very seriously by employers in every sector and every industry. So we're now going to open up to our audience questions, and I can see there's lots of questions already. So thank you to the audience for being so engaged. I'm going to start with the first one on my screen. Have you got a risk assessment template to share with us so we can start using it? I might ask you, Amy.
I might actually throw this one to Libby. I think she's been a bit more involved in the development of this, if you don't mind.
Yeah, that's fine. There actually is, if you have a look at the WorkSafe webpage, if you have a look at the mental health page, when you look at the hazards, there should be links to stress, and there is a risk assessment template under there somewhere. So it's under the stress.
Great, thank you. I've got this person who got in very early. What happens if your workplace just does not acknowledge that there is a culture of bullying and management have no motivation to change? Any advice for our audience there? I'm going to say...
I'm happy to jump in if you like.
Amy?
Yeah. So look, I think ideally what we would encourage people to do if they're experiencing a work-related issue is to raise it internally. And I mean, obviously the example we've got here is someone who's feeling like they're trying to do that and they don't feel like it's being addressed. So if there are potential hazards that are impacting on staff in the workplace, there are opportunities for WorkSafe to be involved. So we have an inspectorate that can look at health and safety issues, and the way to engage the inspectorate is by contacting the advisory line and having a chat with someone there who can give you some guidance around the options that are available to you to support you through that process. But of course, the first step is going to be, or the first question is really going to be, have you raised this with your employer, and trying to get an understanding of the actions that they've taken to help inform us about what we might need to do and where we might need to target our actions if we're going to take action.
Thanks, Amy. Some really good advice. Got a question here, which I might be able to help out with an answer as well. Will psychosocial hazards become part of WorkSafe's notifiable incidents in the future? Libby, do you want to tackle that one?
Not in the foreseeable future that I can tell, as it relates to the current structure for notifiable incidents. However, if you look at the criteria for notifiable incidents, sometimes psychosocial hazards can actually fit within those criteria. So it's important to understand that if anyone does receive medical treatment, for example, if the work-related violence results in lacerations or anything like that, it is important to actually understand that there is the requirement to notify for such things already existing in our Act.
Yeah, absolutely agree, Libby. Psychosocial risks can definitely result in those triggers that are already in our legislation, but at this point there is no legislative change on the agenda. What should psychosocial risk prevention plans contain? So Libby, you spoke about our template earlier. Does that include some help for
Yep. So when we're looking at, I guess, the term prevention plans, it may be that you're thinking, or that it's alluding to the proposed regulations. That terminology is used in the proposed draft regulations for a prevention plan, and so those that proposed regulation does actually lay out specific things that are required into the prevention plan. So I won't go there, but when we're looking at if you have an existing risk register, it's important to use that in the meantime. So making sure that you are considering psychosocial hazards the same as you would a physical hazard. That's the most important thing, is that, if you have a system for looking at the risk associated with a physical hazard, then you should also be looking at it in the same way for a psychosocial hazard.
Thanks, Libby. How do we teach our staff boundaries so that they recognise at the onset, not at the chronic point? Amy, do you want to have a go at that one?
I guess I'm trying to understand a little bit about what the question is in terms of boundaries. But I guess if we're talking about identifying at early stages when there are concerns, I guess it's probably really important that staff are aware of, like, there's a bit of self-reflection or ability themselves to be able to identify if there is a concern, and to feel comfortable to raise that concern with their employer at an early stage. And where that comes from is an environment of psychological safety where people feel comfortable to be able to raise concerns and have the feeling that they're going to be heard. An environment where they can speak openly about issues in their workplace, and they will be taken on board and action will be taken. So it's, I think, initially about creating that environment. And then in terms of staff, I mean, there is some opportunity for them to be able to recognise in themselves when they need to raise an issue. But I think as well as that, there's a responsibility on leaders and team leaders to really look at identifying early signs and changes in their staff that might suggest that they are under stress and pressure. So it could be that there's stuff going on in their personal life, or it could be stuff that's going on in the work environment. But I think the key for the manager and the team leader is being able to identify those early signs of change in their staff members. So if there was someone who used to be very active in a team meeting, but now they were completely withdrawn or they don't engage, that I think in itself is a sign that it's worth following up with them. It's worth having another conversation, even if it's just to present your observations and get a bit more information. And it may be something that's going on for them personally, or it may be something that's going on in the workplace, but having more information can help you then determine the action that you take. You can then offer additional supports to that person at that early stage if you've been able to engage with them, and link them into what they need externally, or make changes in the current work environment to help them to cope better through the difficult experience that they're going through. So it may be about giving leadership the tools that they need to be able to identify those potential early signs of distress in their staff. I don't know if that answers the question.
I think it does. I think it was about that kind of, what can we do in the early stages before something gets into be quite a significant problem. I think that's such a good, some good advice about, being able to really pick up on staff members changing of behaviours. It can be a really good indicator that something's not quite right. So thank you, Amy. So Libby, I might throw to you.
Sure.
How do you believe the psychological health regulations can be best implemented in the workplace when they come into effect?
Okay.
Sorry.
I might start with the current obligation. So you currently have an obligation to reduce the risk to your employees as much as possible right now. The regulations, or the proposed regulations, look at using a risk management framework. That's currently in all our guidance material anyway. So if you want to have a look at our guidance material as it is on our website at the moment, it gives a really good insight into the expectations that you will manage those risks and how to do that, and what some controls might look like. Obviously, for every workplace will be slightly different. So it's really useful to have a look at all the guidance material that's on our website right now, and to understand how to put in place that risk management system for psychosocial hazards and what that might look like for you.
Thanks, Libby. And of course, WorkSafe will be preparing and publishing guidance for employers when and if the psychological health regulations are made, including a psychological health code that will be able to help employers to implement the regulations. Is there going to be adjustments made to the training of HSRs to understand how to apply the risk management framework to psychosocial hazards?
Yeah, really good question.
I can see you nodding.
Sorry, I'm just jumping in there. Yeah, really good question. There's a lot of work being prepared in the background in anticipation. So I know that this is one thing that that WorkSafe has been preparing, is training for HSRs.
That's great. So a question here about the reporting in the psychological health regulations. So obviously the psychological health regulations, if they were to be introduced, have a section where employers have to report certain psychosocial complaints. So this question is about what is WorkSafe going to do with the reporting? What's WorkSafe going to do with that data?
Yep. It's a good question. And I think if you have a look at engage.vic.gov.au, it does set out the intent behind this reporting data on the RIS document. I know it's a large document, but it is around trying to understand better where we can target prevention. So it's not targeted at an individual employer. It's looking at trends, it's looking at where we need to focus our attention to prevent mental injury and psychosocial hazards in workplaces.
Thanks, Libby. That is a big document, but I think there's a table of contents, so hopefully you'll be able to navigate it if you do decide to have a read. So another question, when do you anticipate the psychological health regulations to be made? And I can answer that one. The government is continuing to review and consider stakeholder feedback on the regulations and is anticipating making the regulations in early 2023. So this person says that they understand mental health is an important issue in any workplace. However, as claims are based on perceptions of the claimant, how does a company mitigate these? So I think that's talking about the subjective behaviour element, which I think you talked about a little bit earlier, Amy. If you wanted to expand on those behavioural parts of psychosocial hazards.
Yeah, look, I think that whether it's about perception or not, it's that at the end of the day, there is a feeling that this hazard exists. And I think, you know, I talked a little bit earlier about work-related factors and hazards. And, you know, for some people, some things are not a hazard, but for others they are. And so we need to be aware of that, and we need to manage that and prevent mental injury as best as possible by being aware that that could potentially be a hazard within the workplace. So it's about having an understanding that that's a possible hazard and what the likely impact of that might be if that was a hazard, and then what are the controls that you can put in place to try and prevent that hazard as best as you can. So an example of that might be that somebody's may have put a claim in relation to bullying and harassment, for example, in relation to a manager, and so it's about having those systems in place to prevent that as best as possible. So it's about having policies and procedures, but it's also about training your managers and making sure that your managers have the skills that they need to be able to have those challenging conversations, that they're appropriately resourced, that their workload is manageable, and looking at all of those factors to ensure that the manager is in the best possible position to have a conversation that is you know, unlikely to be perceived as bullying. And then if the person feels that way, it's about having those systems in place at an organisational level for that to be appropriately escalated and to be looked into if it needs to be. So it could be in relation to facilitated discussion, so a mediation process to try and help resolve a potential conflict or understand what's going on. It could be about going down an investigation pathway if it gets to that point around, do we need to investigate these complaints? And all of those processes can then give you confidence as an employer that you're doing everything that you possibly can to reduce the impact or prevent as best as possible the likelihood that that hazard will present itself. I hope that answers it.
I hope so too. I think that was some really good advice. So thank you, Amy. So this person has asked about the onus on employees. So we have today focused a lot on employer obligations, and it has seemed to be that there is a lot of obligation on the employer when it comes to psychosocial hazards. But of course, employees do have obligations under the health and safety regime, the OHS Act. Livy, do you want to answer what
Sure.
obligations an employee has?
Thanks. Yeah. So it is important to note that employees do have a responsibility to their own health, but also to others around them. So they're not, they are responsible. They need to make sure that they do not put anyone else at risk as well. And I think that's what this question is probably alluding to, is that individual responsibility. So, for example, if your employer does have processes and procedures in place, like Amy was mentioning, then you have to then follow those processes, and you should follow those processes. And if they give, I guess, tools to you, same as any physical hazard, your employer gives you tools, you have to use those tools, or you should, as best as you possibly can. And so when we're looking at here, we're looking at responsibilities around code of conduct, behaviours that you exhibit in the workplace. Those kinds of things are particularly important and particularly relevant. We do see sometimes that issue come up as part of a response visit.
Thanks, Livy. It's definitely a shared responsibility across everyone involved in the workplace. So this is a question about quantifying when job demands are reaching the point of a hazard. So Amy, do you want to take that one? How do you quantify when job demands, I guess, are getting too much or become high job demands, or alternatively, low job demands?
Yeah, absolutely. So I mean, I guess it is dependent on the work that you do and the nature. Like, every organization is going to be different, every role is going to be different, and every individual is going to perceive things differently. So I think that was, the point that I was making before, that for some people, they work really well under high pressure, high job demands. And so for them, that's less of a hazard. So it can be hard to quantify it, but I guess it's about, this goes back to that overall culture and environment of being open to hear what your staff are experiencing, and trying to work through for them as individuals, what do they need to be able to do their job, and working on that for each individual and creating that environment to manage that as best as possible. So it might be about making modifications to the work environment if someone's feeling under pressure, or it may be that overall you identify that there is a resourcing issue because you can see this issue is occurring with lots of staff. But ultimately, by consulting with your staff around their feelings and talking to as many of them as possible around what they feel capable of coping with, it gives you a really good insight into whether the demands are manageable or not, and really unpacking that, and that will help you to be able to determine if it is a reasonable or unreasonable or modified, and create an environment where all of your staff can feel supported to do their job.
Thanks, Amy. I'm going to stay with you because I've got another question that's very similar to what you're speaking about. And so it is about people coping with situations and workloads differently, and how employers can deal with that. And this person's asked whether there's reasonable workload demands. Like, is there some kind of objective workload demand threshold, or is it really just about those individual, like looking at the individual staff members and making those assessments on more of an individual or subjective basis?
Yeah, look, I think it can be both. I think, or it probably is both. I think it's about, it's about looking at the job overall and doing kind of a job analysis. If you're identifying this is potentially a problem, and looking at the reasonableness of the amount of work in the amount of time. So analysing each part of the job and determining, is this reasonable for a person to be able to achieve this within their work hours? So that gives you an overall sense of that. But then on an individual level, it's about understanding that with each of your staff members from a manager and a team level, and really making accommodations if you need to help that person feel supported and to assist them to progress and to develop if they need that support, or if they need some modifications, talking that through with them, what they need, what's reasonable for them and what's reasonable for you in terms of adjustment, and working through that together.
Thanks,
I don't know
Amy.
if anything you want to add to that, Libby. Sorry.
No, that's okay. There's another question, and I think you have answered it really well in terms of the job demand, and I think this could be applied across all psychosocial hazards. So again, it's about the individual differences and how employers can account for those individual differences in psychosocial hazards. But I'm assuming that even though you were just talking then about job demands, that it's the same for all psychosocial hazards.
Yeah, definitely. Yeah.
So with respect to incident reporting, if an employee reports being verbally abused by a member of the public, how should this incident be classified? So I'm not quite sure if that is referring to the proposed psychological health regulations or if that's referring to our current notifiable incident framework. Libby, I don't know if I think verbal abuse from a member of the public in terms of our current notifiable framework might not be notifiable.
No, correct. It would be classed as, if you're looking at it from, and I guess to some extent it could be gendered focus, or it could be non-gendered focus. And if it's non-gendered focus, it's work-related violence would be the classification. And to some extent, the important thing is that it actually is noted in the system, and that controls can be put in place. As the legislation currently sits, it doesn't mean that you have to actually put a label on it necessarily at this point in time. But yes, that would be work-related violence or gendered violence, depending on how, I guess, your investigation comes up with potential causes.
So important for an employer to take note of it, to put systems in place to prevent it, but not necessarily notifiable to WorkSafe currently.
Correct.
Let's see, what else have we got here? This might be one for you, Amy. I know you've been speaking a lot about what employers can do and the tools that they have available. So what kind of tools can leaders or safety and wellbeing professionals use to help them identify and manage psychosocial hazards?
Yeah, so there are a number of different tools that they can use in terms of like the key is consultation. So it's about understanding or finding a way to engage with your staff. So it would really depend on the size of your organisation. And if you look at our Work Well toolkit, there are some resources there that can help you in terms of looking at the size of your organisation and what might work for you. There are the People Matters survey is available. There are other tools out there, but ultimately the key is about engaging with your staff and understanding what the hazards are, and the best way to do that will depend on the size of your organisation.
Thanks, Amy. I would definitely encourage everyone to check out the Work Well toolkit. I actually took my team through it a few weeks ago, and it's really helpful, really user-friendly, and has some really good action items that you can put in place pretty quickly. So that's a great suggestion. So this question is about the proposed psychological health regulations, just about reporting. So this person has heard that we'll need to report every 6 months on psychosocial incidents, and will a template be provided? So I might just answer that by saying WorkSafe will be providing guidance and templates and information to help employers with any obligations in the proposed psychological health regulations, and we'll be looking at those things more when the psychological health regulations are made, perhaps early next year. So So this person has asked, how do you verify psychosocial hazard claims? So I guess that's if an employee reports a claim of psychosocial hazard, how does an employer verify that claim? So I guess in terms of a physical hazard, you can go and have a look at the, at the spill, but a psychosocial hazard is a little bit different. Livia, do you have any advice on that?
Yeah, and I think, as Amy's touched on, the key is consultation, and also it may be that you do an investigation, a formal investigation, or it may be that you actually have consult with your HSRs or your health and safety committee. They're really important. They play really important roles in this as well. And it may be that you look to other data sources. So if you look I guess it depends on what hazard it is. You may have high turnover, you may have high sick leave. There may be other keys or indications to verify that this is actually happening and there is a hazard and it is actually impacting on people's well-being. So there could be any number of sources of data from that perspective.
Yeah, that's a really good advice to look to other data sources. Amy, did you have anything to add?
No, I just agree with everything that Libby said in terms of just looking at all of the sources of information from a HR, OH&S reporting, and the consultation, really going down to that individual level and talking to your staff members about their experiences in relation to that hazard.
Thank you. So this question is about training of inspectors. So of course we have our psychosocial inspectorate up and running now. So what training do inspectors undertake specific to controlling psychosocial hazards in the workplace? Libby, did you?
Good question. We're currently revising our training and reviewing that, as we do always when it comes to training. And we actually have, so my team is a support to all the inspectors. So we're all qualified psychologists, and we are inspectors as well. So we can go out to workplaces and support inspectors if that's something that they need, if there's a particularly complex case, etc. So we do have training, and then additionally we have psychologists who can go out in the workplace as well.
Okay, so I'm conscious of the time, so I might get to one more question and then we might start finishing up. So someone's asked, how can we implement a program of support with resistant management in a workplace that deals with vicarious trauma 24/7? So I guess, Amy, you've been talking a lot about the systems that we can put in place as employers, but if our management is resistant to those systems, do you have any advice for what employers could do in those circumstances?
Yeah, so I guess there was a similar question earlier on in relation to what do we do if our management aren't engaging with us, or they're not on board in terms of the risks or the challenges that we're experiencing. So yeah, look, I would encourage you internally to raise that however you can. If you reach a point where you don't feel like it's been heard or responded to, we obviously do have the advisory line that is available for you to get advice and support about the options that are available to you to provide you with support. In terms of what an inspector might do, they might come out to the workplace and have conversations with your employer about there being about the systems of work around that potential hazard. So we can then explore that with them and look at whether there are opportunities for them to improve in that area.
Great, thank you, Amy. So I'm going to finish up. I know we've still got some questions there in the chat, and if we haven't got to your question, I'm so sorry. Please give the advisory line a call and you can ask your question there and we'll get back to you. Otherwise, I have just been told that there will be an on-demand version available after this session finishes on this same link if you wanted to participate in that. So thank you so much, Amy and Libby, for answering these questions. Can I ask you both for some final takeaway points you'd like to leave our audience with? Libby, I'll start with you.
Thank you. So I guess lift your gaze, look beyond the obvious specified hazard. There may be others there. And as Amy mentioned, for example, a bullying complaint that you may see every single day, It may be that there is a psychosocial hazard behind the scenes, and you can't just assume that someone needs to go to an EAP and that will solve all your problems, because it may be that you actually need to prevent this from happening by dealing with that high job demand situation. Also is important as a people leader, your role is absolutely critical in helping implement the systems that your employer has, and to be able to identify as well, as Amy was talking about, that early identification. Making sure that people are really clear on what their roles are and what the expectations are of them, and having those conversations and making sure that communication is open as a team, and maybe having check-in points or something like that. But really important to making sure that people know what they're doing, people know that they're supported, and give credit to the right people. So credit people when they do something really well.
Thanks, Libby. And Amy, anything you'd like to emphasise for the audience?
Yeah, thanks, Nat. I just suggest taking time to know what the psychosocial hazards are, and to really understand what they could look like in your specific workplace. And I guess that the key to prevention of psychosocial hazards is having a robust risk management framework. And that means being able to identify those risks through consultation, so engaging with your staff or using a survey like People at Work, and finding ways to manage them that work for your employees and your workplace. So engaging with them, understanding what the risk is, and then identifying the controls based on your conversations with your staff members.
Well, thank you, Amy, and thank you, Libby, for your terrific insights today. And thank you to our audience for all your wonderful questions and for being so engaged. We are interested to hear about your experiences and feedback of WorkSafe's Health and Safety Month session and the overall event this year. And we'll be emailing a quick survey to all attendees. As a thank you for completing the survey, you'll go into the draw to win one of 5 $100 gift cards. Winners will be notified by email or phone number if you've supplied one in November. And this webinar will also be available online via WorkSafe's website next month, so you can review it at any time. We'll note shortly on the screen a list of the contacts that we've talked about today that you may find helpful if you're concerned about psychological safety in your workplace. And tomorrow at 9 o'clock, we'll be presenting a session called Preventing Work-Related Gendered Violence that talks about psychological factors as well. So I hope you can join us for that one too. If you have any requests for further information, please get in touch with us, our WorkSafe advisory line, and we also have the emergency line open 24/7. So thank you very much for watching.